Once again, there's not many events where we sort of start bang on time when we're waiting, particularly for over 200 people to come back in. So thank you so much for coming back and joining us this afternoon. We've got a wonderful session ahead of us now for the next 3/4 of an hour or so, and then we will be taking a break before our final two speakers for the afternoon. So I'd like to introduce you to our four panellists to the left of me here this afternoon. We've got a series of questions that we'll be working through together in that period of time, and then at the end, time permitting, which we'll make sure we have got some time and 5 or 10 minutes for any questions that you may have for any or all of our panellists that are on here on the stage with me this afternoon. So, firstly, I know many of you were in the room a little earlier today to hear Dr. Georgi Toma, but for those of you who weren't, so Georgi is an expert in stress, burnout, psychosocial hazards and workplace psychological health and safety. Founder of Heart and Brain Works, a consultancy that offers a comprehensive solution for mental health at work. She's also an honorary research fellow at the University of Auckland and is looking forward to discovering Tasmania as she heads up to Launceston tomorrow on the highway as well. If you've got any touristy tips for the trip up there, they'll be appreciated as well. But she conducts research on wellbeing at work. So would you please welcome Dr. Georgi Toma. Next to Dr. Georgi, we've got Adam Nebbs, who is a published public health researcher at the Menzies Institute for Medical Research, specialising in workplace mental health. His current research focus on supporting workplace stakeholders in developing systematic approaches to workplace mental health. So it's nice to have you here with us. Adam, welcome to you. Professor Angela Martin is a Professor of Work and Mental Health, also at the Menzies Institute for Medical Research, University of Tasmania, and Director of Pracademia, which is a private consultancy. Her expertise in occupational health, psychology and management education has influenced workplace mental health research, policy and practice both nationally and internationally over the past 20 years. So it's lovely to have you here with us, Professor. Welcome. And last but not least, Fiona McCarthy is a WHS and human factors consultant based here in Tasmania. As an occupational therapist in injury management, Fiona developed her strong interest in WHS and injury prevention. Has led WHS and wellbeing functions in government, higher education and health. So please welcome Fiona McCarthy as well. Welcome to you. First of all, what we're going to do in this topic, which is based on psychosocial hazards in the workplace, we're going to touch on the topic of understanding psychosocial hazards. So I might start with you, Adam, if we can. How would you define psychosocial hazards in the workplace and what sets them apart from other workplace risks?
So there's obviously a technical definition that WorkSafe provides, but probably the simplest way I'd explain it is it's each and every one of us, we're quite different in the way we think, behave, our attitudes to things, the way we like to work. Just imagine all of us working together and interacting and our differences in the workplace, interacting with each other and our differences. And quite often in our workplace setting, that's probably not designed for contemporary humans to work optimally together. So within all of that complexity, you have psychosocial hazards. And the way these are different to other occupational hazards is they're quite often invisible. They're very dynamic, complex. They interact with each other and other physical hazards. And they're subjective. So again, because we all have our own ways of working, we're going to perceive these to be quite different. And so there's challenges there in identifying what are the causes of these hazards, the effects of them, and over time. And because we can't identify cause and effects like we do with other hazards, it's quite difficult to control for them. So yeah, there's a lot more complexity and messiness, I suppose, in these compared to other occupational hazards.
Professor Angela Martin, I might come to you next, because I guess rolling on from that, what are some of the potential consequences, I guess, of psychosocial hazards?
It's a good question, because that's something I've spent a lot of time finding out about through research, which is sort of how we became aware of these and their impacts. So obviously, firstly, there's a legal impact now because it's regulated, and people are pretty familiar with the reputational impact of organisations that don't manage these issues or don't manage them well. But from a research point of view, we always sort of go to mental health first with psychosocial risks, and that's because there is pretty good evidence that exposure to psychosocial hazards increases risk of mental health conditions, or for people who already have mental health conditions, it increases the risk of exacerbation or worsening of their condition, or perhaps interferes with their recovery from their condition. So the mental health conditions that have been most studied are depression, anxiety and PTSD as a result of work-related factors. And one of my colleagues who does some health economics research has also found that if we just even look at 2 hazards, not the 14 on the list, job demands and the sense of control we have over our work, that can explain something up to 10 to 20% of the variance in depression. That's with Australian data. So the mental health side is obviously the one we go to first, but there's a lot of stuff also on musculoskeletal disorders. Fiona does a bit of work in that area also. But the one that, I try to remind all our executives of is cardiovascular disease. There's also plenty of evidence that links stress to heart disease. That's the top 3 impacts, but there are a whole range of other health impacts. I've got a study showing up to 22 different other health conditions are affected by psychosocial hazards. I just wanted to make that that's about employee health and employee wellbeing. It's also about the wellbeing of their families, if they have a work-related psychological injury. Then we've got a whole range of organisational. I mentioned legal and reputational. But I think you're going to ask Georgie about that, so I don't want to steal her thunder. But there's plenty of business reasons to also be focused on psychosocial hazards.
Great teamwork, great segue as well to come to you, Dr. Georgi Toma. But what are, I guess if we're looking at trends and realities, what are some of the most common psychosocial hazards currently affecting Tasmanians in workplaces, but also how have they evolved in recent times?
I'm going to pick up on what Angie said. Probably one of the most common one is high workload. So high job demands, and job demands being grouped together as a category, and amongst that category you have high workload. But I think it's important for us to not forget that there's 4 subcategories under what we call high job demands. So workload, the amount of work is one of them. But you have high work pace, having to work very fast. And this is a psychosocial hazard with a quite high risk of a psychological injury. Then you have emotional demands and you have high cognitive demands. And quite interestingly, when you look at the data, over the last years, high cognitive demands have increased significantly across the population, not only in Tasmania or Australia, but in general globally. And it is interesting as to why that has happened. And of course, to some extent, our jobs are complex. We have to handle complex systems, interact with people. But in my personal opinion, the type of distraction that we have from our mobile phones and social media compounds this. And it's an example of how our personal lives do influence our subjective experience of work aspects and whether they are stressful for us or not. So as I said, high workload, high work pace would top the list. Next to that, I would put poorly managed organizational change. And I think it's important for us to understand something. Psychosocial hazards do not operate alone or in isolation. They operate as clusters. So when you have something like poorly managed change, for example, for sure, as a side effect of that, would be some team is experiencing high workload, poor job control, job insecurity, lack of role clarity, right? So these are hazards that are clustered. And I guess on the third, at least from what shows in our audits, the third place would be incivility. So incivility is disrespect with ambiguous intent. Incivility is on the rise, and oftentimes we don't measure it. We measure bullying, we measure harassment, sexual harassment, because that's a legal duty, because we've been doing it for a while, but we know those tend to be underreported. So oftentimes we don't measure incivility. And if you don't in your organization, I recommend that you do. And you can use a question like, have you witnessed or experienced instances of disrespectful behavior at work? See what your people say, because that is a fairly innocuous question. It's more likely to give you data and show what's the real culture, what's the environment.
Angela, anything you'd like to add to that?
Just about the sort of impacts for the organisation, I guess, is that not just, most organisations struggle to attract and retain good talent. Not managing it is going to make that worse. But also sick leave and absenteeism are, well-known outcomes for the business. And, of course, productivity, performance, whatever type of business, that looks different. But we all know how we feel in terms of the way we behave at work when we're very stressed and run down by work-related factors. So just, it's not just, it's obviously the health of the employees, but also the health of the business.
Yeah. No, thank you. Dr. Georgi, I'll come back to you because I guess how do these hazards impact on employee mental as well as physical health, but I guess as well the overall organisational performance with these hazards?
So I'll take maybe some practical examples. I think we've all experienced stress at work at some point in our work lives. Most of the time, the first symptoms are sleep disturbances. So you stop being able to sleep well. You wake up tired. Then what happens is you become more irritable. You become more irritable and you're more likely to be a bit snappy with your family, potentially with your colleagues. That creates that climate for incivility to take place. When that climate happens, it affects one of the strongest protective factors, which is support from colleagues or sense of community at work. A protective factor is an aspect of work that is good, that provides what is called a job resource. So it helps people to meet the demands of their work, right? And it reduces the negative impact of psychosocial hazards. They're very important in the workplace. So in our story, all of a sudden, your support from colleagues is not there as it used to be. That's just one example of how it has a knockdown effect. And it affects a person's mental health, as we've heard from Angie, but it spreads in an environment, like a virus, if you will. Just with incivility, because that came to my mind, there's very interesting research on incivility, and that's actually a comparison that comes from research that incivility spreads like a virus. It's a work group phenomenon, and it's not an individual problem, right? It's not that an individual X has a nasty personality. It's the work environment that allows them to present in a certain way. So that's just one example. There's mental health concerns, and Angie very rightly pointed out to the other cost to the organization. And there's a very interesting study by the New Zealand Research Institute that shows that exposure to psychosocial risk causes poor well-being, and that poor well-being impacts a person's decision-making and productivity for an average of 12 weeks a year. That's pretty significant. So when you think about exposure, if you will, or impact, if you look at that piece around cognitive functioning impairment, so you don't make good decisions anymore. And that obviously affects your productivity, but it makes you make mistakes. And that can be a serious hazard, depending on the sector you're in. So when you look at incidents, for example, and that's something that, when we think of what's the next step in psychosocial risk, the next step is when you have incidents like physical safety incidents reported or near misses, do you go in and you explore why did a person make that poor decision? Because I can guarantee if you go in and explore why someone made that decision, you will see that there might be psychosocial hazards present there.
Thank you. It's a very fascinating insight into it. And I'm going to bring you into this conversation now, Fiona McCarthy, to perhaps share an example of an actual case study that demonstrates the psychosocial hazards in the workplace and the impacts that they have on employees as well as obviously the organisation.
Thank you, Rick. I'd just like to pay tribute to psychosocial hazards and the knowledge that we have about the impact of this on people from our many disciplines that contribute to this knowledge: psychology, sociology, public health, and some of the best minds in Southern Hemisphere are sitting here with us who contribute that knowledge. As a WHS professional, I'd just like to highlight a couple of really great things about the WHS lens, which is another contribution to this discussion. Because what I find with my clients who are in business is that they are completely overwhelmed by this topic, that there's a lot of information, and I think WHS lands psychosocial risk management in a place that we can all handle, manage and do really well at. So my examples are going to highlight a couple of tools from WHS knowledge and skills and how they've been applied by businesses just like you guys in real situations in my work. So to start off with, due diligence obligations. We're trying to land everything that we do in our due diligence obligations to know, to understand, to control, to verify how we're managing these things. So everything we do is referenced back to the WHS lens. Remembering that all the legislation about this and what you need to do is sitting in WHS, okay? It's not sitting anywhere else in terms of where you guys live. It's in WHS regulation and acts. So that's what you need to be focused on. Consultation is one of our most important tools here, and I know that my colleagues here will agree that consultation is what gives us the texture and the granularity that we need to really nail these hazards. So first example, and both of these are from a formal risk assessment that we have done. So it's either an Affirm toolkit or a People at Work survey. Can we have a show of hands of who has done a formal WHS psychosocial risk assessment in this room? Has anyone done? Yep, lots of people have been involved in People at Work probably, fewer the Affirm toolkit. So as you know, you come out with a score and you get a traffic light system. So green means not too bad, just keep an eye. Amber means there's a problem and you need to address that, you need to find out more. And red is urgent, do something immediately. So there's a risk assessment process in these assessments. So here we are, and bullying is always red. So what I say to my people before we start is, please don't be alarmed with what you find. When you ask, people will tell you. So you don't need to panic if you find out about bullying, violence, all those nasty things that you don't want to know about, that would rather not be present in your organisation. Remember, this is just information. It hasn't happened yet. It's a gift. We're being told about what's coming. It's like looking upstream and seeing something coming towards you. Hasn't happened yet. It's people's sentiments, beliefs. You're going to capture lots and lots of different information, incivility. You're going to capture bullying. You're going to capture all sorts of things. But you could just have people having interpersonal strain as well. So the first thing is, do not freak out when you get a score for bullying or violence. Rather, let's drill down and find out. So let's have a look and see what happened when an organisation got a big red flag for bullying and freaked out. Okay, the next part is that you have a focus group or you have a consultation. That is always a part of the process because the graphs that you get are very generic and they're very two-dimensional. If you want to find out what's going on, you have to talk to the people who do the work, right? So what did we find out? Where was this bullying happening? Because we thought everyone was getting on just fine. The bullying was coming from the customers, and it was coming on the telephones, and it was very high-value clients in a very, very high-value business where everyone was being super polite to customers and customers were not being polite to workers on the phone. So we sat down with our focus group, which was actually a risk management team, which was a group of workers and leaders sitting together, exploring the problems and exploring the solutions together and making an action plan. And this is the wonderful work that they did. They did a customer review to see what was annoying the customers, why they were getting cranky, and discovered quite a few things about, you know, the upstream factors to an angry customer. We also looked at what other businesses were doing around this, how they were managing it. And we were looking at things like messages on the phone about respect. Our people will respect you and try and help you as best they can. We ask you to also be respectful in return. So all of those things that I'm sure you're thinking of solutions as well as you're sitting there about what you would do in your business. So all of these things got put into an action plan. Now, just calling out the WHS lens, primary prevention is when you tackle the risk at source, right? You start to think, why is this happening? And you tackle it at source. That's a primary prevention. That's elimination. That's the top of the hierarchy of control. Okay, so I'm just calling that out to you. That's a WHS sort of construct model. Secondary support. Support to workers who are going through these sort of experiences. Manager support, team support, discussing how different approaches worked and coming up with more solutions and supporting each other. That's a secondary intervention, okay? Because something bad's happened and we're supporting people to recover from that and to be resourceful around that and to actually think of a different way and have job control, which is another job strength that we want to encourage. Now, the other thing that we do as safety professionals is we always try and find out what's working well, okay? So we say to people, what's helping you in your work? What are the things that make it easier for you? What are the supports that make you feel stronger to handle this stuff? And we document that, and we do more of that as well. So they all go into our safety action plan that we then review and that we then tweak again because it's an iterative process. So that was one example, bullying. And it certainly wasn't the end of the world, and everyone felt so much better when they were working together on this problem. They could see management was listening, and it was a strengthening process. Example number 2. Same situation, did a survey, shock horror, we had violence come up. Big red flag. How could our staff be experiencing violence? And violence was sort of categorised, I think, there's all sorts of horrible things there in the people at work, spitting, biting, shouting, all sorts of horrible things for violence, threatening, okay? So what we drilled down with our risk management team and we discovered it was one particular role that was subject to this. And it was the duty person on the front desk dealing with triaging new clients in a very high stress environment for the client. Clients were all up against the wall, financially, legally, whatever. Everyone was under stress who walked in that door, and you never knew what you were going to get. And it was seen as a bit of a rite of passage, that role, so often was given to a junior person who would do it for 5 days a week, 8 hours a day. Okay, so the first thing that came out was this is the worst job in the place, that people told me that. It was busy, unpredictable. So another WHS concept is exposure. Okay, usually exposure that is long in duration is more harmful for people. So one of our plans included sharing that job around with more people and having the person only on duty for half a day with a full day doing something different, and other people sharing that load and putting it in the safety plan and the risk register and putting in lots of other controls around that. That's a primary control, job design. Secondary area as well, or another primary area actually, was that people said they were exposed to biological hazards while they were doing this triage work. So they were experiencing blood and saliva being sprayed on them. That's complexity. there's another hazard in there that we have to control. So all sorts of solutions came up for that, starting with elimination, because we don't want our workers exposed to biological hazards. There's 2 examples, and I hope that sort of landed it in practicality for you and made you feel like, yeah, we could do those sorts of things. We could manage psychosocial risk if we broke it down, if we understood, and if we weren't leaning away from it, but leaning into it, because we're not scared and we can manage these things.
Thank you so much, Fiona. Wow. It just shows where, I guess, from an organisational point of view, what we should be striving for. And Angela, from a cultural and communication perspective, what does a psychologically safe workplace look like to you?
Well, that question I want to not sort of harp on about definitions, but psychological safety is a different concept than psychosocial safety, which is going to make you all go, what? They sound the same. There's been a lot of work done in workplaces on psychological safety that comes more from the business literature, innovation type of literature about how people sort of work in a team to be creative and productive. And so the idea that you should be able to speak up about things that impact the work and sort of share different opinions in a safe way that means if we speak up, we're not going to be worried about losing our job the next day. So that's a sort of psychological safety. It's about the feeling you can take some sort of interpersonal risks to put your ideas forward without bad consequences. But psychosocial safety is the regulated space, which is about our psychosocial hazards, our listed 14 in the code of practice we follow in Tasmania. And so what a psychologically safe workplace that is managing psychosocial risks looks like is one that is just actively going through this process that Fiona's beautifully described of assessing risks, prioritising the ones that really urgently need action, collaborating to get the right sort of controls in place, and then monitoring how well they're working, and round we go again. So it's a continuous improvement process that looks at hazards and controls and monitors it and improves it.
Fantastic. Thank you for that explanation. Adam, trust is vital in a workplace, and I'd like to ask for your opinions here in the case of what would make employees trust their employer enough to actually feel comfortable to talk honestly, openly about stress, burnout, whatever might be on their mind and impacting them at work.
It's a really good point, and I was very happy to see in the model code of practice a particular section in there that talks about, if psychosocial hazards aren't being reported, what some of the reasons could be. And I think we could all appreciate that probably over the years we've raised concerns about various things, and sometimes they're not received in the most positive, constructive way. So this is where we've got to kind of do that cultural work to go, okay, while it's great that we've got the regulations in place and we've probably got systems by now in place, we do work in that complex workplace environment that I mentioned earlier to say we're working with people and sometimes we have different opinions. So really, at an organisational level, it'll be about building that culture where people don't fear reprisal, and that could be, are you following through on things? So if I'm being brave enough to speak up and potentially bring up a controversial subject, it could be to do with my line manager, co-workers, and again, we can appreciate the interpersonal dynamics are a lot more scary, I suppose, than some of the other occupational hazards that you will raise. If your workers are doing that, that's wonderful. But what are you going to do to follow through? And just ensuring that people feel safe that if they speak up, that they won't be blamed or gaslit, or there won't be anything that kind of puts it back on them. And, sometimes things will be very sensitive. We can appreciate things to do with sexual harassment, workplace violence, bullying. These are areas that are very sensitive. If people have been traumatised in the workplace, how can you build different pathways to speak up rather than, potentially through a survey or in a safety talk so that those people can bring up these sensitive issues and they're actioned appropriately. So, yeah.
Thank you. And look, in our time remaining, I want to just open this up particularly on practical solutions. So, and feel free for perhaps either one of you to answer this question, but what role does leadership play in creating a psychologically safe workplace. If anyone would like to perhaps comment on that.
I reckon we can all say something about that because it's so critical. I mean, some of the work that I do is trying to educate executives and boards about this whole area. Why are we being made to do this? You know, this is really difficult and, you know, we don't want to do this. So leader attitudes and some of the research around what leaders do is particularly important. There is a concept in the research called psychosocial safety climate, and it's all about how leaders talk about balancing productivity with wellbeing, that they communicate about it regularly, that they feel comfortable talking about impacts of poorly managed psychosocial hazards. So that's one concept, and they've shown through research that just even these 4 simple questions about your leaders can predict the level of claims, can predict you know, a whole lot of the exposures that Fiona was talking about. So it's kind of seen as a cause of the causes of poor mental health in the workplace. So I would say leaders are absolutely essential, and if they don't get it and you're in a WHS role and you get it and you're trying to help improve your organisation, you're going to get very stuck, and it's not a nice position to be in.
No.
I don't know. Does anyone else comment?
Yeah, so I think that's really important, the psychosocial safety climate piece, and I think it's making sure in your organisation that, you know, there's a commitment and it's prioritised, because I think we all need to do it now, but the workplaces that are going to get this right and unlock the appropriate resources and responses will be the ones whose leaders up top get involved in it. There's a really useful resource some of you may have seen from the Australian Institute of Company Directors, which is a primer for boards and directors around what should boards and senior leaders in businesses understand here. And I think we can appreciate that senior leaders around the organisation have to think quite strategically, and this can be quite operational. But still, it's very important that they're on board, because those people will be the gatekeepers, the decision makers that allow the resources to kind of flow through. So just making sure that there's that understanding from the top, and then it'll ensure that when this is done at an operational level, we have the appropriate resources. So.
Totally agree, and just wanted to add maybe onto how to do that. Probably one of the key factors to do before doing a risk assessment is getting your leadership on board with implementing actual controls on the backing of that risk assessment. Otherwise, your risk assessment can be more damaging to your people. So how do we get that? And I'm going to share with you a piece of advice that's not mine. It comes from a CEO we recently interviewed. We run free monthly webinars for health and safety professionals like you, and we had just a CEO of an aged care organization last month, and that was a question to her. What if, from our audience, what if my leadership team doesn't understand this or doesn't support it? How do I get them? How do I get their buy-in? And her advice was, learn to speak their language. Every senior leader has some vision, right? They want to leave their mark on the organization, and they have something that matters to them. For some leaders, like for her, for example, culture was the most important thing. She said, if I create a culture where my people feel cared for, appreciated, and respected, they're going to perform. That's what mattered to her. For other leaders, it's productivity. Whatever their language is, whatever their language is,
Sorry, Georgie, that's
they will remember this. If they remember anything, it's going to be the dance.
sorry.
We all need to get up, really, don't we, and do a bit of exercise. We'll do that shortly. It's fine.
So she said, link this to their language. So if it's productivity, you have the KPIs around productivity. You have the KPIs around your worker compensation claims and how much it's costing your organization. You have the KPIs around turnover and how much it's costing to get new people, right? So get their buy-in by using their language.
Thank you, Georgie. Fiona, did you have anything you wanted to add?
Just a tiny thing, but
Sure.
first, I'm deeply sorry for that That's not supposed to happen up here. It's supposed to happen down there. Sorry. I just wanted to say, look, I totally agree with everything everyone said. As a WHS person, I know that a lot can be achieved from the bottom up. Health and safety reps and committees and all sorts of worker and small, low-level team initiatives can work really well in safety. But psychosocial risk management never works well unless it comes from the top. So I would say don't do a survey unless you're going to be able to act on it. I've seen surveys done and nothing come out of it, and it causes more harm than good. People lose trust. They think, why should I bother? Nobody's listening. So I think, just to underline everything everyone said, don't start without people from the top being on board and ready to respond.
Thank you all. We are fast running out of time, and we're obviously going to open it up to the floor very shortly, but just a couple of further topics. To you, Adam, what practical steps can organisations take to foster a culture that supports mental health and wellbeing?
So it's a really important question. So some research that I worked on is I worked with 6 businesses in Tasmania for 12 months to help them plan to implement the ISO 45003 standard. I'm sure many people here are familiar with that, but if not, it's the first global standard for psychosocial risk management. And the purpose of that study was to bring different organisational functions together. So HR, rehabilitation, safety, other wellbeing related functions, bring them together to make sense of the recommendations in the ISO and tailor those to the organisation. And what was really fascinating out of that research was, even though each of these businesses we interacted with had the same intervention, the same opportunity to have those functions work together, our organisations traditionally work in silos when it comes to this issue. We may silo this to safety or to HR, and while we can have different functions together, there can be silent signals we send to each other which say this really should probably sit under the remit of work health and safety or HR. So the point I want to make there, and I brought a 2D, 3D shape, probably quite random. We'll see how this lands for this crowd. You're my tester. So what I really want us to think about is we are in a 3D world, and each of us will see things from a 2D perspective, okay? So think to HR, work health and safety, wellbeing. Some of us will see things as circles, some of us will see squares, and some of us will see triangles, okay? So back to my earlier point around the complexity of psychosocial risk is we need to appreciate this is a 3D problem, okay? And what we're doing right now in many workplaces, because we silo this, we can only see it from the limited 2D perspective. So what's really important is to bring these functions together, and it's not always easy because our cultures can signal this should be something that sits under the work health and safety remit. But it's about saying, okay, let's go back to our workplaces and say who is responsible for controlling this? What are the limitations potentially of their viewpoints? Because we could all appreciate HR will see things differently to work health and safety. And based on those limitations, how is that limiting our ability to understand these issues and to solve for them? So my first advice there from a practical sense is go back and just have a look at how we're siloing this. And there's nothing wrong with that. I think that's probably common practice everywhere. The other thing, and we talked about it in terms of the leadership piece, is the study that we did with those 6 businesses was one where we didn't always have senior leadership buy-in because this is perceived sometimes as an operational issue. And that meant that the people we had in these teams didn't always have access to the resources and the time to do this. And so it meant while we had 12 months with these different people, sometimes they wouldn't have the opportunity to meet outside of the formal meetings and actually work through what's a really complex subject. So again, really important that if you decide to undertake something here, make sure it's resourced, your senior leaders are on board, and that it's not something that you kind of expect people to do off the side of their desk. It's just too complex. You really need to free up the time and space so people can do this well. So, yeah.
Fabulous. Thank you for sharing that. And I'm going to come to you, Georgie, for final question before maybe some final messages. But from an example, and I guess a real-world example from yourself on how organisations have successfully managed psychosocial hazards and actually improved the well-being of employees.
I'm going to give you an example from an aged care organization that we work with. As you can appreciate, in aged care, there's a lot of psychosocial risk, right? For one, there's exposure to occupational violence. There's the opportunity for moral injury, vicarious trauma, and the particular workforce or the particular organization we work with had a completely remote workforce. So when you work fully remote, it poses its own challenges to culture. How do you form that organizational culture? And I mentioned to you before that support from colleagues and sense of community at work, these are really strong protective factors. So it's not something to ignore, right? And so what was good about this particular organization was that the leadership was actually on board and was genuinely committed to doing something about psychosocial risk. So we went through the first risk assessment and we uncovered a series of risks. Now, most of the time, organizations do know what their major risks are. It's nothing completely new to you, because even with this, the legislation on psychosocial risk might be new, but you're already doing a lot of things to manage these risks, right? So that's one thing. So nothing was completely surprising, but what was interesting is, so when we have our own tool that assesses over 30 hazards, and it has an algorithm that classifies the top psychosocial risks. We give the top 5 at organizational level and top 7 by demographic category. And it's really important when you do your risk assessment to break it down by job profile. So job profile means the people in your organization who do similar tasks, because they will have different risks. So for example, your frontline staff is going to have a series of risks that are different from your office-based workers, that are different from your line managers. So when you do that assessment, figure out what are these worker categories in your organization and do the risk assessment like that. Then go a deep dive by worker category and record that in your risk register. So we did that with them, and it is really important for us, and picking up on something what Fiona said, the data, the numbers give you a story that's two-dimensional, and you have to go in deep to understand what's the root causes of issues, right? And so with them, we were able to identify that, so high workload was an issue, right? And what were the underpinning causes? There were 2 main. One was organizational change. The organization was going through rapid software change, and it was needed. But it was taxing people's resources, because learning how to operate a new system is taxing. I know for me, whenever Microsoft decides to do an update, I become irritable for 2 days, right? So that was one. And the other cause was, very interestingly, a part of their process for taking notes and sharing those notes across shifts about a particular patient. That process was not standardized. So that meant that some employees were taking notes and saving them in the system in one way, others in a different way. What that added to the cognitive load of the person who came on board trying to figure out, oh, I don't have all the information, oh, I have to ask this, I have to ask that. So high workload was actually underpinned by the organizational change requiring to learn new things, high cognitive load because of that, and this particular lack of an effective process. So when you think of that, okay, what's the control? That's the control that's going to be more effective to manage high workload, is not hiring more staff and putting them in the same position, is rather established a standardized procedure to take patient notes, a standardized procedure to record them only in one system, not duplicate them over several systems, and make sure that when you train your new staff, that's done appropriately. And so then workload, because we measure it year on year, right? And so we were able to actually quantify the effectiveness of this control, and it worked. So this is just one specific example. Obviously, I can't go into all the details. There's more hazards and blah, blah, blah. But this is just one small, seemingly small issue, solution that can have quite a big impact.
Thank you so much for sharing that. We've been very fortunate this afternoon to have 4 wonderful people joining me here up on the stage. The the clock is talking to me, as you can see. You can't see this, but we are fast running out of time. But we would love to just open it up to the floor for a few minutes if you're happy to take any questions. So we've got a few minutes. If any of you would like to ask any one of our panellists a question that you have on your mind, please pop your hand and we'll get a microphone to you.
Dr. Georgi, you did touch on software updates. A part of our lives that is fast increasing is artificial intelligence and the use in the workplace. I was just wondering if there's been any research into potential links between the risks of psychosocial hazards and AI.
I think several of us can answer that. Off the top of my head, I can't quote research on the impact of AI, but I can, as with any new technology development, it's got pros and cons, right? I have seen the use of AI simplify jobs. I've used it in my day, to compose emails, for example. It saves me time. I say this in a nice way. It says it. I copy paste it into an email. It saves me time. So there's positive aspects of that. As with any new technology, learning how to use it in an ethical way and in a safe way is going to demand effort. I think with AI, it's really important to understand how you use it and how it also has implications for physical safety. I think that's where it has perhaps more of a chance to be a psychosocial hazard, because there's a lot of technology, physical safety technology, that uses AI. And when you deploy that across your people, so to help them with movements, for example, or to scan their eyes once they work on a production line, or whatever physical safety technology you might implement, now that is where you want to ensure that you consult with your staff and you see what's the impact that this technology has on them. Or the technology that uses AI, which monitors people's performance. So you have technology that can see, how much time someone is away from their screen, or what, this kind of surveillance type of technology.
I was just going to say, Comcare now has excessive surveillance, digital surveillance, as one of their hazards that's not in our model code.
Yeah.
Great question. Thank you. We might have time for just one or two quick questions. If anyone else has got a question, would like to pop their hand up. Just one just there, and then we'll come to you in just a moment for a final question.
Thanks, everyone. Adam, maybe for you, because you touched on it, please, and this may be a naive question, but I'm confused as to why you would say, in terms of, if your business or organisation takes this on, make sure you've got resources. When it's something that's part of the WHS Act itself, shouldn't every organisation have something to support psychosocial hazards and risks?
Yeah, it's a good point. I mean, the good thing now is that we do have the regulations. I think there's just been a lot of research over the years in Europe who've done this for a long time that's found, even in those countries that are regulated, and it's very different in Europe, there's the, overall European directive, and then countries can decide how they take that on. Even in those countries, though, they haven't found a significant drop in psychosocial hazards and exposure to those hazards. And so this is the thing, while the model code of practice in Australia will tell you the minimum guidelines of things that you can do, it's, there's still that variance. There will be some senior leaders or boards that won't quite understand the importance of this and won't put in as much time and resources into it. And this is how a lot of businesses, even some of those I've worked with, that will meet their minimum requirements, that reasonably practicable aspect, and that's fine. That's from a work health and safety perspective, acceptable. But again, the research really shows that those businesses that have that upstream leadership commitment are more likely to have better resourcing, better controls, better outcomes. So.
And I just wanted to say, to add to it, that some of the research shows that managing directors, only like 30-40% are even aware of this duty. So there's willful ignorance, but there's also just general ignorance. And a lot of it's going to come down to prosecutions and the evolving deterrent as well.
And just, I think it's a very good point when you said, this is legislation, there should be resources allocated. But you know, the reality is, at least for a lot of our clients, it just fell into the WHS people's lap, and they have to do it on top of their existing duties. There's no awareness that they need more time, or that maybe there's another team member that's needed, or whatever. So, yeah, and it comes back to what Angie and Adam said, you know, that you have to educate your leadership that, hey, this is a new duty, and it does require time and resources allocated to it. I can't just do it on top of my already full-time job.
Thank you. We get one quick final question just over here on this side of the room, and then we'll wrap it up. Just pop your hand up. Thank you.
Sorry, I'm not sure if it's quick. Sometimes you hear something in a presentation and it really resonates, and it was right at the very beginning when Georgie mentioned the word incivility, which is disrespect with ambiguous intent. If I've got it right, it really resonated. It probably resonates for others in the room too. I just wondered, that obviously collides with a whole bunch of stuff, a lot of isms, sexism, ageism, which some of us heard probably about in a concurrent session earlier. At an individual, at an organisational level, I wonder if anyone on the panel could perhaps give us some examples for solutions. Thank you.
I was just thinking, we all probably have a code of conduct in our employment conditions, but probably if I ask any particular one of you what's in it, you wouldn't know, maybe. The big things that you know you're not supposed to do are in there, but there's nothing about, you know, just being nice at work to people. So code of conduct is one tool, and what I think is it's behaviour needs to be more part of our performance assessment rather than just the technical aspects, so how we sort of show up in the culture, and that would be one aspect of it. So, yeah, that's one idea. Anyone else?
I would start with an identification of the root causes of incivility. So here you have usually a mix, but in this mix, there's high workload. So there's that piece of hazards that cluster. So when, again, people go through high workload, poor change management, these are two of the main hazards that cluster with incivility. The second thing that I want to say here is that what we often see is that poor behavior of a person is tolerated. Either one, because the person is in a senior management role, or two, because it's considered a high performer. So that behavior happened, and it was tolerated for those two reasons. Or the third one is their manager is too afraid of conflict and didn't give them feedback. It's just avoiding it, right? That was tolerated. Over time, incivility spreads as a virus. As I said, it's a work group phenomenon. So people were like, well, if that person is allowed to treat others like that, I'm going to treat others like that. So what is the solution? The solution is, first, after a risk assessment, you have the grounds for making an objective call for change. You say, okay, this is what we've identified, that's a problem, and we're going to have an intervention, and what you need is a culture intervention. So culture intervention is you're honest. These behaviors are not okay. Example 1, example 2, example 3, very direct. This is what we want. And I think in a culture intervention, what you need to have is an example of what's not okay and an example of how to rephrase that. You are frustrated because the IT system is annoying, so you call IT. You want to scream. What can you do? Breathe before the call. This is stupid as an example, but but you give someone a script. If you experience this type of frustration, this is an appropriate way for you to voice it. This is an appropriate way to bring out conflict. A lot of people are conflict avoidant. It is important to give people the skills to manage that in a way that's not disrespectful.
Fiona, I think you just wanted to make a quick comment.
Yeah, I've got just a couple of handy things that have worked, that I've seen really effectively work. One is along the lines of what Georgie's just said about people becoming confident to talk about behaviour, is the above the line, below the line metaphor that you might have seen. So it's about calling out behaviour. I think that was below the line. And that's your opening way of giving feedback. And a leadership team that got behind that and then told everyone, the executive, said, we want you to call us out too. Right? So giving permission to cross those hierarchical boundaries to call out things. The other thing that I've found really great is workplace contact officers, and they could be trained by Equal Opportunity Tasmania to be first responders if someone's got something that's a bit fishy and they want to get some advice, and they're there not to advocate but to give information and options. And that starts to open up the conversation, and we can collect data about those inquiries. They don't have to have big labels like bullying, but they can have a label like interpersonal conflict, gender, whatever. And you can collect data from that as well. And I just wanted to say I brought some case studies. One about Tasmanian bakeries that got shortlisted for the Best Health and Wellbeing program in Australia last year in the Australian Health and Safety Awards, over there on the table if anyone wants to go get a case study.
Thank you. Well, look, to the four of you, I'm sure everyone agree, your contributions to this afternoon have been wonderful. We appreciate you giving up your time to be here, your expertise, and certainly a wonderful educational perspective for all of us here. So to Dr. Georgi Toma, Adam Nebbs, Professor Angela Martin and Fiona McCarthy, thank you very much. Please show your appreciation.